Welcome back. I'm Anastasia, and my mission is to build a community of acceptance and authenticity. I needed some adventure buddies for this journey of insight, and I am so glad that it's you. You are all welcome here, and I'm grateful that you decided to join me and our guest for today, Dr. Damijey. She is a board-certified endocrinologist who started sharing knowledge on Instagram at Hormones with Dr. Damijey in the hopes of increasing our insight and awareness of our own bodies. We talk about how she got on this path, her passion for women's health, and advice that she has in regards to paying attention to symptoms, finding a doctor who will listen to you, and how an endocrinologist can help you. So let's get started and see if we can build some insight today. I also want to take a quick moment to name that since the recording of this episode, PCOS, polycystic ovarian syndrome, has been renamed to polyendocrine metabolic ovarian syndrome, or PMOS. This is based on what we now understand about this diagnosis and how it shows up in the body, and it being more about hormones and metabolic reactions. And so maybe I will need to have Dr. Damijey on again to explain these differences and why it's so exciting, or follow her on Instagram because I know for a fact that she talks about it. But at any point when we talk about PCOS, know that we are now talking about PMOS. Welcome.
Thank you. Thanks for having me.
I am so glad you're here and that we're going to have this conversation today. Now, I want to admit, I've never been to an endocrinologist. I know vaguely that there's hormones involved, but I would love for you to maybe start by explaining who you are and what it is you do.
Absolutely. All right. So my name is Dr. Damijey, and I am an endocrinologist. I'm a board certified endocrinologist, and I'm going to tell you what endocrinology is all about. So endocrinology is a field of medicine that studies the hormones in the human body. The hormones in the human body are molecules that are produced that helps to regulate a host of things in our bodies. So take, for example, your thyroid gland produces the thyroid hormone, and that regulates a lot of things. It regulates your body temperature, your body weight, your bowel movements, your heart rate, your skin, your hair, your nails, a lot of little things that that overall compound to make a big difference. The pancreas produces the hormone like the insulin. And if your pancreas is not working well and you don't have enough insulin, you can become diabetic. So it is really important that we learn about these hormones, how they work, when they're working in excess or when they're not working enough. And that's basically what I do every day. But there are tons of hormones in the human body. Those are just two examples.
Okay. How did you get into this work? Like, how did you get to this chair that you are in today?
That's a very nice question. And I'm honestly going to say it wasn't a straight line. It wasn't like I always knew I was going to be an endocrinologist. But what I did know is when I was in medical school, I understood the concept of endocrinology. It made sense to me. When all my colleagues and friends were like struggling, understanding the feedback mechanism and all, it was crystal clear in my mind. So I put in my back pocket like, hey, I think I like endocrinology, but I still kept my mind open. I wanted to learn about other fields of medicine to see if there was anything else that would interest me further. But, as time went on, I realized this is something that I really like. This is something that I really enjoy. And it has a great work-life balance. It doesn't pay a lot of money, but it has a great work-life balance.
Same.
So I put all that together and I was like, I think I want to be an endocrinologist. Then I also have, family members that have like diabetes, thyroid issues and all of that. So it just made sense for me. It was just the perfect fit for me.
Okay. So you said it wasn't really a straight line. It wasn't linear. Was that for endocrinology, or was that to even become a doctor at all?
To even become a doctor at all.
What did you used to want to be? Like, what was your initial dream?
I always knew I wanted to be a doctor. That's the good thing.
Okay.
But the path to becoming a doctor was very, very convoluted.
Tell me more. I want to hear.
All right. So we haven't talked about nationality, but probably you know, probably you don't know. I'm Nigerian, born and bred, raised in Nigeria. And I went to school, high school, and all of that. And I got into a medical school in Nigeria. So I started my medical school in Nigeria. And after my first year of medical school, I was kicked out. I was kicked out of medical school for failing medical school by 1 point. By 1 point. Yes, yes.
That's so upsetting.
It was so upsetting. I said, I'm not going to be a doctor anymore. I don't want to do this anymore. So I studied biochemistry. I did biochemistry in my undergrad, and I graduated with a second class upper degree, which is like the second best degree in my country. But after that, I still kept feeling like I'm not fulfilled. I still want to be a doctor. So I started talking with my family, and I told them that I still wanted to be a doctor, but everybody supported me. They were like, do you want to go back to medical school in Nigeria? Do you want to go abroad? Then I started talking to friends and, people, and I realized that I could go to the Caribbean where I could actually become a doctor really fast, as long as you have the funds, the financial support to get through medical school. There's nothing like victimizing. There's nothing like, people just kicking you out for no goddamn reason. So then I went to the Caribbean, and then I studied and became a doctor from Windsor University School of Medicine in St. Kitts. Then after that, it became a challenge to get into the US. You have to take all the boards, you have to pass all the boards and all of that. All those I passed, all those I got in, straight. But to get a visa to come to the country was a problem. So I applied to come to the US 6 times before I eventually got a visa to come in. But eventually everything worked out fine, and here I am today. It's been a very long
glad
time.
that you are working in Massachusetts where you are now?
I absolutely love it. I definitely do love it. I love what I do. I love the people that I work with, and I love the patients that I cater for. There would always be those, maybe 0.1% or 0.5% of people that you can never satisfy. But the overwhelming majority, they're all glad that you're here. They're all happy that you're here. In fact, sometimes I hear rumors like patients will just come in and be like, I heard you're leaving. I'm like, from who? It's like they're so paranoid. Like, I hope you're not leaving. I hope you're not leaving.
I mean, that's actually been a big thing for me. I grew up all over the world. I grew up in the Middle East and Southeast Asia and came to America as an adult.
Oh, nice.
And I never had consistent medical care. And the most consistent I had was through university, because I went to the university doctor. So I had 4 years of the same doctor. And even since then, every time I find a new doctor, I see them once and then they leave.
They gone. Yeah.
And so, having an endocrinologist that stays, that knows your case, that can work with you through the whole process.
Correct.
So important for trust and rapport.
Correct. It's very important, but there's a huge shortage of endocrinologists all over the world, and especially in the US. And people are constantly looking for better. Like, if you get a better offer, or if you find a place that is warmer, not as cold, or somewhere that is better for your kids, or sometimes your husband gets transferred, it's always one thing or the other for why people are constantly moving. So
yeah, no, it makes sense.
Yeah.
You're human too. I get it.
Exactly. outside of medicine, we also deal with the same things that every other person deals with. People get sick. People have reasons that for whatever they have to move.
Yeah. Well, and before we hit record, I think it was before we hit record, you were talking about how it has a great work-life balance. What does that mean for you? How do you balance work and life?
That's a great question, because I've been through training for so long. I've been in medical school for so long, where you've missed friends' birthdays, you've missed Christmas, you've missed holidays. There are lots of Christmases where I was in the ICU when I was a resident, or lots of Sundays where I can't go to church. But after graduating all of the training and becoming an attendant, the good thing is I work Monday to Friday.
Yeah.
My Saturdays, I have it. My Sundays, I have it. My nights, I have it. I do get calls when I'm on call. I get calls at time like, hey, there's this patient in the ER. We just want your opinion. What should we do? How do we stabilize? That's fine. But I don't get, I get to say, okay, these days I want to be off. These days I'm not going to be here. And it's fine.
Oh,
It's
that's nice.
fine. It's so nice. Like you can plan the year ahead and be like, I won't be working from these days to these days. Even if emergency happens, the thing I love the most about where I work, if I call today and say I can't come in tomorrow, they'll make it happen, even though I try not to do that, because then they have to cancel on those patients that were already scheduled. But it's a very flexible work-life balance. I've heard colleagues that are like, oh, even if they're like sick, they still have to show up because it's so rigid. They make it seem like the medicine is built around, you're built around medicine. Medicine is not built around you. So I love my job. I'm not even going to lie to you.
I can tell you're very passionate about it.
Yeah.
Okay. So let's talk more about endocrinology. Which diseases, diagnoses are your favorite to treat or your favorite to try to understand and explain?
So I am a general endocrinologist, meaning that I do everything endocrinology, but I am particularly passionate about women's health. So women's health, these are conditions that specifically affects women. Things like PCOS, things like menopause, things like osteoporosis. Osteoporosis affects men too, but mostly women. Things like prolactinoma, irregular menstrual cycles, facial hair, those kind of things. But I love thyroid. I love, adrenal conditions, pituitary. I love everything, but I am passionate about women's health.
Okay. What does like helping in women's health, treating women, like what do you want women to know about hormones and their life? Because I know so much happens, especially during menopause, but during all these different things that you described, so many of us have been gaslit to believe, oh, we're just stressed. Oh, just drink more water. And nobody even knows what symptoms to look for.
That is correct. That is absolutely correct. And that is what my social media is all about. It's all about educating women, empowering women, so that if you know that something is not right, seek help, speak up, ask questions. And if you're not getting the answers that you need, ask for a second opinion, ask for a referral to another person. A lot of women are going through a lot of things that they just think it's normal, not knowing that it is not normal. Lots of young women are going months without their periods and they think it's normal, not knowing that it is causing havoc. Not having your period on a monthly basis is actually wreaking havoc on your body. Not getting, your periods, I said that, facial hair, things like thyroid, being tired all the time, getting poor sleep, thinning of your hair, all sorts of things that women just think it's normal. It's not. And these things can also impact not just your physical health, but your mental health. I've dealt with all sorts of women across the board because I'm an adult endocrinologist. So I see women from the age of 18 up to 100 or even more. But I've seen lots of young women, like, 19-year-olds, 21-year-olds, being diagnosed with PCOS and being completely clueless, not even knowing what the diagnosis means. Yet, a lot of women are being shamed, thinking, oh, you just have to lose the weight. If you lose the weight, your PCOS will get better. But we all know that inherently, to lose weight with PCOS is one of the most difficult challenges in the world. You could starve yourself, exercise, do everything, and yet you won't drop a pound. So these women are left frustrated. A lot of them blame themselves for this diagnosis that they didn't put on themselves. And it's just kind of sad to me, which is why I try to educate. I try to, put information out there and hopefully I can do my part in the world.
I can feel the passion coming through the screen right now. And just also, I mean, I feel it. I feel so frustrated that it has been normalized. That I know I have several friends who have PCOS who are doing their best to manage it. But honestly, I don't even know if they've been to an endocrinologist.
That's the thing. That's the thing, right? A lot of people are diagnosed by their primary care, some by their gynecologist. And I'm not trying to throw any specialty under the bus, but I feel like when it comes to hormones, everybody that has PCOS should see an endocrinologist because there is a lot more that can be peeled off from this diagnosis that your primary care doesn't have the time to go into detail with you. The gynecologist doesn't really have the time or even the knowledge to go into the details with you. So, and a lot of people don't even know that they should be seeing an endocrinologist in the first place. So they're just like dealing with it and going with the flow.
Yeah. So, what would working with you be like? Let's keep with PCOS. If I had it, I got diagnosed, let's say by my GP, and then I came to you for an appointment, what would you do? What would be different?
What would I do differently is the first thing is even just explaining to you what PCOS is, letting you know that it is not your fault that you have it, letting you know that the fact that you were told that you have polycystic ovarian syndrome doesn't mean that you're infertile, doesn't mean that you cannot have children, doesn't mean that you're going to, be overweight all your life, doesn't mean that you would never get a regular period, doesn't mean that you're just going to have to deal with the facial hair. There are lots of things that we can do. I can talk to you about how we can regulate your periods depending on. So this is how address my patients with PCOS because PCOS is a spectrum. And as you grow, the spectrum of the disease changes. It changes. So an 18-year-old with PCOS and a 35-year-old with PCOS can have two completely different presentations.
Interesting.
Yes. So if an 18-year-old who is in college comes to see me for PCOS, their priority might just be, I want to lose some weight and I want to deal with the facial hair. I'm tired of the facial hair. If a 35-year-old person comes to see me with PCOS, maybe I've been married for the last 5 years and we've been trying to conceive. We can't get pregnant. Or I've lost, my sexual desire. I don't have the drive for sex because I'm so overweight. I'm so fatigued. I'm so tired all the time. So you see now that their goals and what they want from their endocrinologist are completely different. So if you use a one size fits all approach for everybody that has PCOS, you will not be addressing what their root problem is, what their major concerns are.
I feel like I could listen to your voice all day. Like if I ever need an endocrinologist, I'm going to fly to Massachusetts and just start working with you. It's so calming. It's so reassuring. You keep repeating like it's not your fault. I'm like, yeah, it's not my fault. This is hypothetical, but I just feel so
but I'm
good.
telling you, the number of people that think that it is their fault and that they have to starve themselves or just find a way to lose this weight because they can stop eating, they can stop craving sugar, which is all part of the disease process. It's the disease that is causing the insulin resistance, and the insulin resistance is why you can't stop eating sugar. So if we address the insulin resistance, we can put you on medications, we can help you even understand what you should be eating. I can send you to a nutritionist. I can send you to a dermatologist who can do electrolysis and help you with the facial hair. I can put you on medication and then send you to a dermatologist. And in combination, we can work together instead of you plucking the hair every day.
Yeah. What I appreciate about how you're framing this is you really are thinking about your patients as a whole, thinking about every variable and every facet of their life and where they're at in their life journey.
Where they're at in their life's journey is so key, especially for a condition like PCOS. If I said everybody that has PCOS, because it also manifests differently, two people can have PCOS and one is skinny without facial hair, whereas another one is obese with lots of facial hair, and they both have PCOS.
Mm-hmm. Yeah. So it's not just a checklist. Here's
It
one
is
medication.
not.
You really
Yes.
have to see each person as they are.
As they are. Exactly.
Ugh. Your patients are so lucky to have you because not every doctor does that.
I agree.
You started sharing by saying like people have to fight. And if it doesn't, they're not getting the answer they want, they have to go find someone else and get a different referral. And that is so true. How many times before I was diagnosed with my stuff that somebody just told me to drink more water? I was like,
Yes.
this doesn't feel like the right answer. And I had to keep going and keep hunting until I finally found somebody willing to zoom out and see me.
And the funny thing is, even in endocrinology, not every endocrinologist likes women's health.
Mm.
Not every endocrinologist. You could go see an endocrinologist whose passion is thyroid. And if you're talking about PCOS, I'm telling you, they're just like, oh my God. Because it's not something that they really have passion for.
Yeah.
Or you're talking to them about your hot flashes from your menopause and your poor sleep and your night sweats when they're a diabetes specialist. So even inside the endocrinology doctors, as few as we are, there's still, you still have to fight to find the right one.
Okay. So as you became passionate about women's health, has that always been there from the start, or is that something that you developed later?
It wasn't always there. I promise you. It wasn't always there. I've always been someone who is like an advocate for people. I like to speak for people. I like to fight for people. But when I hear about, marginalized people like children, women, disabled people, it's like something stirs up inside me to defend those people. So when I started endocrinology, I realized that lots of young women were seeking help from the internet. They were going to the internet because they weren't getting the answers that they needed from their doctors. So I would be scrolling my TikTok and I would see like an influencer or somebody who calls themselves like a health coach. And they're like, hey, you should never use birth control. Birth control is giving you fake periods. You should do this. It causes cancer. And I'm like, what the hell are you talking about?
Yeah.
Like, this doesn't make any sense. And it kept going, it kept going, it kept going. I was like, all right, fine. I'm just gonna make a little video, short video, and just talk about the real thing, talk about the science behind it. So that was how it started. I started like making small videos, short videos here and there, here and there. And then it became like what it became today. I mean, it's still like a small platform, but lots of women were like resonating with me, telling me that I feel seen, I feel heard. What you say makes sense. Like, I wish my doctor explained this to me. I wish somebody explained this to me. In fact, one woman told me, I'm already 60 something years old. I know it's over for me, but I will forward your videos to my daughters and my granddaughters. Like, that was so thoughtful and so touching for me. But I felt for her, like, she wished that when she was younger, somebody had said the things that I'm saying, like she could have heard it from somebody else. And I just felt like, yeah. Another thing was I noticed that, when just like you said, when I'm talking to my patients, they're just like so mesmerized, like, wow, nobody ever told me that. I wish somebody told me that. So I'm like, in a day, maybe maximum, I can see 22 patients in a day, but I can make a video that 50,000 people can see.
Yeah.
People outside of Massachusetts, people outside of the United States. I can't tell you the number of times people have reached out to me, like, hey, I'm sending you this email from Kenya or from Nigeria or from Ghana or even Thailand, Korea, all sorts of places. But if I didn't open my social media and open my camera and start speaking, those people would have never heard my voice or heard what I wanted to say.
Well, and your motivation behind it is so authentic. It's not, well, I want followers. It's, well, these influencers are trying to be doctors. So I need to get my voice out there so that someone, hopefully as many people as possible, can hear this information and know what resources are available to them.
Exactly. I cannot be a doctor for everybody, but I can give you the information that you need, that when you go to your doctor, you can ask the right questions.
Yeah.
That's all. That's all I can do. I don't prescribe on the internet. I don't diagnose on the internet, but I can provide you with the information that you need just to get you thinking,
Yeah. Yeah.
and to get you thinking in the right direction, hopefully.
Yeah, definitely. So when you're making these videos and posting it, trying to give people the right information, are there any major themes that you try to get across? Like, what do you wish the majority of people know?
So I try not to oversimplify things because the human body is a very complex thing. And by trying to simplify things, you can lose the core of your message. But at the same time, I try not to speak in a term that they can't understand. So it's really important for you to be able to find that balance, that happy medium, where people know that this is an endocrinologist talking to me. This person is not just throwing words at me, but at the same time, it's not like overtly complicated that they cannot understand it. So that's usually the theme of my message. Make it simple, but don't lose the core of the message.
Yeah. Yeah. And what is the core of your message?
Well, it depends on what topic I'm talking about.
Yeah.
So let's say I'm talking about menopause. I can let them know that it's not just about hot flashes. A lot of people think that menopause is hot flashes, or that, even if I get the hot flashes, I can deal with the hot flashes. But I need to let you know that there's a metabolic condition that is going on beneath. Your cholesterol is being affected. Your weight is being affected. Your bones are being affected. Your heart, you have an increased risk of a heart attack and a stroke if all of these things are not being corrected. So I let them know that even though you think you can tough off the hot flashes, you can tough it out, you're a strong woman. I don't need hormone replacement therapy. My mother did not use hormone replacement therapy. My grandmother did not use hormone replacement therapy.
Well, there were myths that it caused breast cancer and you weren't supposed to be taking it, which is completely false.
Completely false. Plus, that was studies from like 30, 40 years ago. We have more studies now that have shown us that this is not true. Secondly, the hormones that they were using back then were heavy, were more concentrated than what we're using now. So what we're using now are more friendly to the human body. They are less risk of causing those things. And if we initiate those hormones early in your menopausal journey, not waiting till you're 75 or 80, when you're more already likely to have a cancer than when you were like 60s or 50s, in your early 50s. So those are the kind of messages that I try to put out.
Well, and, I'm seeing a theme, a thread through all these examples you're giving, which is there is something to help you.
Definitely.
Just across the board, whatever it is you're dealing with, whatever
Correct.
symptoms you think you're having, there is something to help you.
Correct.
You just have to be willing to find the person to get that help.
Correct. A lot of women, I'll give you another example, think, I can't take hormones, maybe because they've had some kind of cancer, or somebody has told them that they can't take hormones, or maybe because their great-grandmother died of breast cancer. They think that's an absolute contraindication to taking hormone replacement therapy. And that is false. It can't be farther from the truth. One, you can still take hormones, even if you have a family history of breast cancer or whatever. There are multiple different formulations. We have the pills, we have the gels, we have the patches. Like, make it make sense. There's so many options out there.
Well, and I'm stuck on what you said of, women just tough it out. And it's so true. We're taught to just deal with the pain and to sit in the pain and be told that the pain isn't that big of a deal.
Yeah.
And so as we get older and our bodies change, even with menopause, it is such a drastic drop in
Yeah.
hormones, just
Yeah.
suddenly.
Yeah.
Our bodies have no idea what to do with that.
Correct.
We,
Correct.
we don't have to sit in that pain or that discomfort.
Like as women, you go through pain when you start menstruating. You go through pain when you give birth. You go through pain, whether it's vaginally or cesarean section. And then you go through menopause and then you're still in pain. And then menopause, a lot of people also feel like menopause is, at 50, my period stops and then I go into menopause and then everything stops. No. Menopause is the entire period of time from when your period has stopped till the rest of your life. That's menopause. And there also is perimenopause, meaning it can even start years before that final menstrual cycle. So think about it. Most women will live more than half of their life in menopause.
Wild.
Think about it.
Well, in perimenopause, I mean, it can start as early as what, like 30s, like mid 30s?
Yes.
Yeah. And
Yes.
so starting to see those symptoms, our body's starting to change, starting to prepare for menopause. That's uncomfortable too.
Yeah. So if you're probably, let's say the life expectancy is 75 and then you go into perimenopause at 40, that's 35 more years of being in menopause.
Mm-hmm.
That's like half of your life.
Yeah. Longer too.
Or longer,
Yeah.
depending on when.
Are there any recommendations for women that you give around, I don't know, like prevention or things that they could do at home, supplements, or I know strength training is really great for prevention of osteoporosis, but is there anything else that women could be doing?
Yes. So I actually just put a post out like a couple days ago. Like, if you're in your 30s, these are certain things that you need to be doing to prevent you from developing osteoporosis. One, you want to make sure that you are strength training. Two, you want to make sure that you are eating enough protein, that you're eating at least 1 grams per kilograms of your body weight. So if you're like an 80 kilograms woman, you should be eating at least 80 grams of protein per day. When I ask my patients, do you eat protein or what's your diet like? They're like, yeah, I eat a lot of protein. I'm like, do you even know how much protein you should be eating? And like, not really. I eat an egg or 2 eggs in the morning, and then they're probably eating 30 grams of protein the whole day. A lot of people are undershooting what they should be getting throughout the day. I know it's hard, but if you don't even know what you're shooting for, you can't even meet your target. So knowing what you should be getting helps you put it in perspective, like, okay, I need to incorporate this more into my diet. And then maybe, sunlight, getting sunlight. If you're not able to get enough sunlight, making sure you're taking enough vitamins like vitamin D, those kind of things. You also want to make sure that you're constantly utilizing yourself. Like, not just if you have a sedentary desk job, try to get up from time to time. Try to go down, maybe do a few squats here and there, stretches. If you can go for a walk on your lunch break, make sure you're doing that. Avoiding ultra processed foods, things like sodas, snacks. Those are very, very calorie dense and very non nutritious. If you're smoking, you probably want to quit smoking. Smoking increases the risk of osteoporosis. If you drink alcohol heavily, you probably want to cut that down or even discontinue it completely. Those are all things that can increase the risk of a person developing osteoporosis.
Yeah. Okay. My brain is comparing it to my life and what kind of changes I could make.
Yes.
And
Yeah.
I think,
Everybody can make some change.
yeah, oh, of course. Well, and something that I do is I habit stack. So anytime I wash my hands, I then do 5 to 10 squats immediately after. Or
Oh.
while I'm waiting for my tea to heat up, sometimes I'll like plank or go hang from a pull up bar because grip strength is really important as you get older. And so it doesn't even have, I like how you're like, just do a couple here and there, just get up and move a little bit.
Yeah.
So often we go into that all or nothing thinking of, well, I have to make this lifestyle change. I have to change everything immediately. It's like, well, no, can you just like stand up and walk around your apartment real quick before you sit back down for the next meeting? Just
Correct.
do something.
Do something. We all have this all or nothing mindset. If I can't get to the gym 5 days a week, then it's not worth it. No, I can't even remember the last time I stepped my foot in the gym because, like I told you earlier, I'm so busy and I have family. I have a young family. So that's, but I still try to get in the exercise as much as I can. I have a standing desk. I don't sit at work.
I sit at work because I fidget too much. If I stand, I'm just like constantly moving around. So I have to sit when I'm with my clients.
Oh
But
yeah, oh
otherwise,
yeah, oh
yeah.
yeah, oh yeah. So
Right.
in the way mine is set up is I have my own office where I, review my charts and do my notes and everything. But then there's a patient room where you go to see the patient. So I cannot be standing when I'm talking to a patient, but when I'm in my office, when I'm like, doing my notes, reviewing the charts and all of that,
You're up.
I'm up because it's like you're sitting the whole day.
Yeah. Oh my gosh. No, as soon as I finish work and I'm done with my last client, the first thing I do is go outside and go for a walk. I was like, I cannot be inside in this chair anymore.
Exactly.
Okay. So I'm curious if you have any dreams you have yet to realize. Like, as you're thinking about your future and what you've been building here in your work, but also in your social media, what do you hope for?
Okay, so yes, that's a great question because I was recently at a conference and they said, what's your 5-year goal? So, my 5-year goal, I would say, is to probably cut down a little bit on my clinic hours, maybe working 3 days a week instead of the current 4.5 days that I do. And then I want to be more into my, social media. I want to be a speaker. It's one of the things that I really want to do. People have told me that I speak well, so I want to pursue that a little bit. I would love to be able to, talk to women all over the world, go for, women's wellness retreats and things like that, talk about women's health, talk about things like PCOS, the thyroid, the adrenal glands, the bones, the things that I naturally have passion for. But instead of doing it in a patient's room, maybe on a bigger stage.
Wow. Okay. I love this because as you were describing, it isn't just like, yes, helping patients, but spreading this word, helping that larger impact. And maybe even as a speaker, maybe you can help other doctors, other
Mhm,
endocrinologists look at
mhm.
the whole picture
That's correct.
versus this is my one puzzle piece that I know how to
Mhm,
identify. It's like,
mhm.
okay, but what if that one puzzle piece is just a symptom of something larger?
Correct. Correct.
Yeah, helping influence other people to zoom out.
Correct.
Mm.
Helping women better understand themselves, helping women to better advocate for themselves, helping women to understand that you don't just have to suffer in pain. You don't just have to suffer through things,
You don't have to suffer, period.
Period. Period. I mean, there are some things that are beyond us. There are some things that, there's nothing we can do about it. But if there is something that can be done, nobody should be suffering for it.
Yeah. Well, and the number of people that I have worked with who have admitted to me, oh, yeah, I'm starving myself because, I was told I was supposed to lose weight. It's like, but then you're not fueling your body. And then your body's going to go into scarcity mindset and it's going to like hold on to everything and it's going to panic. And this is the opposite of what your body needs to feel
It's
good.
exactly the number of patients that I have to tell, please go and eat. Go and eat. If you eat, then you can lose weight.
Yeah. It seems backwards, but it's
It
really
seems,
important.
yeah, it seems backward. Some people are like living on 600 calories or 800 calories a day, one meal a day. I'm like, please eat, please.
Yeah.
I'm not asking you to go feast on a pizza, but eat the right things. Learning to know what is actually good for your body is one lecture that everybody should get. Learning how to properly fuel your body. You have no idea. And even knowing what the first meal of the day should be, that sets the tone for your day.
Tell
If
me
you
more.
start your day, if you start your day with a muffin, a blueberry muffin with a Dunkin' Donuts, no shame to Dunkin', but with like coffee loaded with cream and sugar and all of that, that automatically spikes up your blood sugar. Now your body is in crash mode, trying to control that blood sugar all day. Now you're tired because your body is working extra hard to bring your blood sugar into a normal range. By 11 a.m., you're already tired. You're already hungry. Now you need a pick me up. You need a coffee, you need this, you need an energy drink, which if you had started your day with like maybe an omelet or something more, protein and balanced that prevents your body from spiking, prevents your blood sugars from spiking, you can set the tone for your day to be more gradual throughout the day. The blood sugar controls a lot of things. It is important for your blood sugar to be in range at all times. But if you're constantly like spiking up and down, candies here, cookies there, crackers there, those things are not good for your body.
Yeah, they don't know how to sustain on that.
Exactly. And a lot of people don't know better. It's not because they don't want to do it, they just don't know better.
Yeah. Or it's, you know, chronic pain or chronic fatigue, and they don't have the energy to cook something. And so they're like, well, this is just easier. This is faster. At least I'm eating something. And to a point, yes, at least you're eating something.
But no,
But they're
but you
like the
do
quick
so-
hacks, you know?
a lot of people also feel like, they don't have the time to meal prep. And I understand it takes time, but if you do it, you will save much more time during the week.
Yeah. Like I do a smoothie in the mornings now. I didn't used to. I used to be a muffin or sugary cereal person for breakfast. But now
Mm-hmm.
I do a smoothie with all my vitamins in it, and mostly like it's mostly spinach and carrots
That's
with a
great.
little bit of protein in there.
That's
And
great.
I feel so much better throughout my day
Yeah.
than I ever
Yeah.
did when I
Yeah.
was, I'm too tired to cook.
So,
So I'm going to have a bowl of cereal, and then it sets me up very poorly for the rest of my day.
yeah, I can already tell where that's going to go.
Yeah, it did. You know the answer. It didn't go well. And, the other thing, whenever I was busy, and I did this a lot in grad school, every once in a while, I still do it today. But there's always the joke of like the ramen mac and cheese diet,
Yeah.
where people are so, they don't know any better and it's affordable. So you just have mac and cheese for lunch. And I used to do that all the time. I used to have nothing of protein, nothing of substance. And now I do these big, like hearty soups. I do one big pot, and it feeds me through the rest of the week. If
Yeah.
I don't meal prep that,
Yeah.
I can feel myself being
Yeah.
drained, not having the energy to work out, not having the energy to get through my day.
Yeah.
My chronic pain flares up.
Yeah.
It really does make a difference.
It does make a difference because now, if you don't have your meal, you're probably going to go to the cafeteria or you're going to go to a fast food and you're going to grab something, which already throws you off of your regular routine. Now there's this, okay, trying to catch up. You're trying to play catch up. Now, what do I do for dinner? Now, what do I do for the next day? And it's just like, it just keeps going. I'm not saying that I'm perfect. I'm not saying that I don't have, Dunkin' Donuts or Starbucks once in a while, but that should be the exception, not the norm.
Yeah. Like you can always give yourself a little treat when you've earned it, when you want
and
it.
that's fine. I am not the kind of doctor who says this is what you cannot eat. No, there is no cannots in my book. It is the moderation. If you want to have a cookie, that's fine. Just know that you will go for a walk after the cookie. Go for a walk.
I heard that one of the best things for regulating blood sugar after you've eaten is to go for a walk for like 20
It,
minutes.
it is. I tell that to all my gestational diabetes patients. Like, if you don't want to go on insulin, just make sure you go for a walk after that dinner and then check your blood sugar in an hour and then let me know what that number is. When they hear that, they're like, okay, fine. I think I can do that. I can live with that. I would rather go for a walk than take some insulin. And I'm like, fine. But it doesn't mean that some people will not need insulin. But for those people who are like on the cusp, should I put them on insulin? Should I not put them on insulin? Like, just go for a walk. After you eat that dinner, try to eat an early dinner, go for a walk with your partner, your dog, whatever, and then check that blood sugar. And it makes a whole lot of difference.
Yeah.
It does.
Yeah. Who would have thought taking care of your mind and body helps?
It does. It sure does. Everything is connected. Your mind, your body, your soul, it's all connected. Some people are very mentally strong. Their minds are strong, but their bodies are weak. Some people's bodies are super strong. They feed their bodies with nutritious things, but their mind is so weak. They, you know.
Well,
So
and
it's,
I
yeah.
agree. And I tell my clients all the time, if they come in sick or struggling or they have an injury, like we're not doing trauma work today. We need to take care of your body. We need to
Oh, yeah.
process this and focus on this so that next time you feel good enough to do trauma work. It
Correct.
all needs to feel in balance.
It is. It is. It is holistic. It is holistic health.
Okay. So I am curious if there's anything we did not talk about today that is lingering in your mind, something you feel is important to mention.
I mean, the theme of my message is women should speak up. That's the theme of my message. If one person listens to this podcast and they're like, hey, doc, I think I need an endocrinology referral, I think this podcast was successful.
Yeah, I agree. Well, and I love that's the thing because that's what you're doing.
Yeah.
You aren't just in your work, in your office, helping your patients. You said, I need to speak up. I'm seeing a deficit here, and this is important.
Correct. Correct. I can't tell you the number of people that have watched my videos and that has prompted them to go talk to their doctors, and they've found things and they've gotten help and they feel better. And it's amazing. It's amazing. So I create this like guides. It's also goes around the same theme of my message, which is make it simple. It is not textbook complex, but then again, know that it is a doctor speaking. This is not just an influencer putting rice, vegetables and smoothies and everything together. There's a medicine behind this message. So I create like guides for people to, download and they can read it at bedtime. It's not an excessively long guide. And it has mostly pictures so that even if you don't feel like reading, you can just scroll through it and get the theme of the message. So,
okay.
Yeah.
And where can people find that?
So it's in my bio, in my Instagram. And I always tell people, like, I post about it and I'm like, if you want to just comment that you want the guides. And so I have the Hashimoto's guide for thyroid. I have the grades. I have menopause and I have PCOS. So those 4 guides are available for people to download for free.
Okay. And I will have the link to your Instagram in the bio of this podcast. I will tag you in everything. Amazing.
Thank you. Thank you.
Okay. Anything else before we stop recording?
Is there anything you want to tell me? Any feedbacks that you have for me?
Oh, I just love you. I think you're amazing. I love what you're doing. I love this passion. I love that you're trying to help people give themselves permission to advocate for themselves. I work a lot with clients with chronic pain and they come in and they say, well, my doctor just told me that I have to lose weight, or my doctor just told me that I'm supposed to exercise more, or my doctor said that this is all they can do for me. And I'm that person sitting here going, find another doctor. Don't keep working with this person. You feel unheard or judged. Stop. Don't do it. find somebody like you who
I
will actually
know.
listen, who
I
actually cares, who's
I
compassionate.
know, I know, I know. A lot of people are also very limited where they are. They don't have a lot of access, they don't have a lot of choice. So they just have to keep working with the same person, whether they're hurt or not. So hopefully
Hard.
it gets better.
Yeah, we need to change the world.
What needs to change?
The whole world. Well, and I think it's so hard too, because even if maybe a doctor doesn't show up well in one session, that doesn't mean they don't care. That doesn't mean that they're
That's
a
true.
bad doctor.
That
They
is
could just
true.
be burned out in the
A
system.
bad day or a
A bad
bad day
Yeah. Like it's
or a
really
bad
hard.
day.
But if you're
Yeah.
seeing the same person over and over and you walk away every time feeling unheard or unseen,
Or even worse than you went in.
yeah, like you need to be the advocate for your own life, for your own health journey. I always tell I always tell people like you're the expert in your own life. I went to school for the tools to help guide you, but only you can know if it's right for you or not.
Correct. Correct.
Okay, thank you so much for coming on.
Thank you for having me. It was a really great conversation, very insightful. And I got to learn about you and your work and the vision behind your work. And I hope that, you continue to grow in your quest.
Same for you. We're going to support each other. It's going to be amazing. Literally, after recording this episode, I went out and told several of my friends about what we talked about what I learned from Dr. Damijey, and they have since gone to see an endocrinologist. So, Dr. Damijey, if you're listening to this episode, I need you to know that your work is already helping us. And I am so grateful for your passion and your care, not just for your patients, but for the rest of us who need someone like you to remind us of what our options are. And if you, as the listener, want to hear from Dr. Damijey more, please follow her on Instagram at Hormones with Dr. Damijey. Hopefully, something we talked about today resonated with you. If it did, let yourself sit with that idea for a little while longer. If you have any questions for this podcast, send us a message on Instagram at Insights With Us Podcast, or send us an email at insightswithus@gmail.com. If you enjoyed this podcast and want to hear more, please follow, like, or subscribe. If you want to support the continuation of this podcast, you can donate. To do so, you can support us on Substack or find me, Anastasia Soroka, on buymeacoffee.com. You can find digital downloads on my website, happymindwellness.com. Thank you for being my adventure buddy. I appreciate you, and I appreciate you being here. Thank you for creating insight with us.